Allan, we have Allan Showalter from the Department of DD, and we're really really glad to have him here. He is Deputy Director of Medicaid. We also have Brandi Nicholson from the Ohio Department of Medicaid. I'm going to read a little bit about Brandi because you guys might not be quite as familiar with her. Brandi has worked in public service for the last 30 years. She currently works at the Ohio Department of Medicaid, where she leads the self-direction program. She's also the head of the Interagency policy section, and this section is responsible for agreements and policies that are used across different state agencies. Brandi also worked in the MyCare waiver, which helps people qualify for both Medicaid and Medicare. She's also worked with, done work at Medicaid, including MyCare Provider Network Manager, where she developed and checked the requirements for access to care and network adequacy. You have a lot of jobs, wow. She was also the head of the clinical operations section, and her team was in charge of the policies, administration, and operations of several Medicaid services. Before working at Medicaid, Brandi was at the Ohio Department of Job and Family Services, and there she managed the home care waiver program and developed quality oversight processes for the state's waiver program. She also worked for DODD and a county board of DD. Wow, it just goes on. Brandi has a master's degree in social work, I love it, from The Ohio State University, and is a licensed social worker. So Brandi, I wasn't going to read it all, but then I was like, wait a minute, this is a lot. And I'm glad that you started there at DD, so we love that. All right, we also have Lisa Foote here from Sandata. Thank you, Lisa. Lisa is a customer success manager at Sandata, recently acquired by, HHA Exchange. She loves to bring her passion for healthcare and helping people to everything that she does. Lisa has a master's degree in health communication from Emerson College in collaboration with Tufts University School of Medicine. Awesome. All right, and then on that note, we're gonna kick it off. I'm gonna make sure you guys have who's starting? All right, awesome, thank you.
Hi, good afternoon, everybody. How are we doing? I'm Brandi. We are very excited to talk to you about EVV. I see some friendly faces out there. Nice to see everybody. We have a full agenda today, but not a lot of content because we really want to give some room for you all to give us feedback. So it is your chance to tell us what you need to help support providers in the EVV space as we move into the claims validation process. So really, we're going to do a little bit of level setting about EVV. Allan's going to do a hello and tell you all what we've been up to. We're going to talk a little bit about sort of how we got to this place with EVV and the places that we're going. We're going to talk about our timelines for implementation, and Lisa's going to share with you some of the support and help that's available to the providers through our Sandata HHA partners to make sure that everybody gets what they need. So when we get to the point of claims validation, everybody's ready. So that's the mission for today. We will try to get you out of here a little early if that's possible, if you don't have a lot of questions. I know everybody's happy about that. All right, so that's the plan for today, and I am going to turn it over to Allan to say hello.
Thank you, Brandi, and thank you everyone for being with us here today. I have a particularly short, I think, part of this presentation today, but I really want to start with kind of the conclusion that I'd like you to leave the room thinking about, which is really thinking about the importance of EVV and the importance of the October 1st deadline that is going to be approaching very quickly. So you're going to hear today from Brandi and from Lisa about the EVV policy changes we've as a system made and how the claims validation process is going to work. But I also want you to be kind of thinking about the work that we are doing across state agencies to prepare providers for this October 1st claims validation deadline. I want you to think about the questions that you as SSAs are going to be getting from providers, particularly as that's approaching and as it's implemented, and hearing about the resources that we've put together and are continuing to put together to help providers and to help boards address this issue and to kind of help everyone smooth this transition along. So what we've been doing is we've been meeting monthly with the Department of Medicaid and the Department of Aging to make sure we're all in tune on the outreach, education, resources, to make sure we're targeting those in the right areas as we move through kind of the claims validation timeline and get to the DODD waiver implementation date of October 1st. We have DODD-specific dashboards to monitor provider progress. I think the summary of that is there's a lot of room for improvement in that. So we're going to be working with providers on that. Our DODD provider support team is already working with ODM and with Sandata to engage providers and to work with boards to help with that provider engagement. We're targeting providers particularly who have not utilized EVV yet, or having a very low matching rate, because there is a lot of both room for growth in that space in the next 6 months and like a lot of potential for disruption if that is not improved before October 1st as well. We are establishing a call center warm transfer process between DODD's call center and Sandata, so that if a provider calls us with EVV concerns, we're going to be able to hand them off to a Sandata representative who's going to really be able to help them with their EVV process without them having to hang up and call somebody else and get frustrated through that process. And we have been developing county board specific EVV train the trainer sessions. I don't want you to think of that as like we're expecting SSAs to be the trainers, but I think that our goal there is to make sure that the SSAs are kind of educated enough in EVV so that if you get questions or concerns, you know where the right resources are, you're kind of able to issue spot in what you're hearing and send people in the right direction to get their questions answered, because we know you're going to be kind of on the front line of a lot of those questions and concerns and complaints. We want to make sure you have the resources to help out as well, and don't feel, and feel prepared for that. So with all of that, I'm going to turn it over to Brandi to start talking more about the substance of EVV.
Thanks, Allan. So just so I have an idea of who we have with us today, if you're a county board staff, can you just let me know you work for county boards? Oh, fantastic. Thank you all so very much. Thank you for your service. It's Public Service Recognition Week, so we appreciate you and all that you do and the passion that you bring to your work, so thank you for that. Do we have any providers, just by any chance? No. Okay, beautiful. So that helps me to know how to help you and how I can hopefully ask you to help us. So thank you. I appreciate you indulging me there. EVV is not new. I imagine most of you have heard of EVV in some way, shape, or form in your service. We are required by the federal government to implement our electronic visit verification process. That was a part of the Cures Act that was implemented by the federal government many, many years ago. The Department of Medicaid actually took our first electronic visit verification system live in 2018. So we've been doing this for a long time. We re-implemented our EVV solution using Sandata again as our partner there, and we refreshed that in July. So there's some new features in the new system, but it is the same Sandata system that folks are generally pretty comfortable with because most folks have been using that for a number of years now. So the 21st Century Cures Act requires us to do several things. And let's go ahead and go to the next slide if it'll pop ahead. Thank you. Oh, these are our rules. Let me do that first. So when we did our revision in July, we actually changed our rule chapter a little bit at the Department of Medicaid so that we made sure that we spelled out some more things in detail. We set our requirements a little bit differently. And then we were able to do some revisions to add in some details and refresh things based on feedback that we had received from our stakeholders. So when we did those revisions, these are the 4 rules. We actually have a whole chapter now for EVV. These are the 4 rules that are currently in place. When you use the, I assume they get the slides somehow from us. There's links directly to these specific rules if you want to read what the actual Medicaid requirements are for the electronic visit verification systems, the data collection, all of those pieces. So that's where you find all of our rules. And then let's go to the next one. Awesome, thank you. So in the 21st Century Cures Act, the federal government basically requires us as a Medicaid agency to collect 6 data elements in any service that is delivered that is a home health service or a personal care service. So in the Ohio model and in the DODD waiver program, that's primarily your HPC services, right? Those are your homemaker personal care, direct care services are most of the ones that your staff that are out there working in the homes would be required to have an electronic visit verification data collected on those actual site visits. These are the 6 elements that we collect as a part of that verification process. So that's what the Sandata solution does for us, is it collects these 6 primary elements for us for each visit that occurs. A couple things that are really important about that. One, we need to know people got the services that they were expected to receive, right? That's one of the primary reasons that electronic visit verification exists. It gives us a record and lets us know that somebody that we expected to come in to provide services at a specific time showed up and was there to provide the services. It also is a really helpful program integrity tool for us to be able to monitor to make sure that people are providing the services that they're submitting claims for, which is where the claims validation process starts to come into place for us. So these are the 6 elements. Again, for folks who've been around for a minute, this might not be new information or different than what you've seen before, but we wanted to just do a little refresher just in case, or if folks weren't familiar with EVV and what information we're collecting. All right, let's go to the next one. And we'll go one more. So the Department of Medicaid announced our full calendar for electronic visit verification implementation several months ago. So you hopefully have seen by now this specific chart. This lays out for us over the course of the next 12 months which services will be subject to claims validation by the Department of Medicaid and the Department of Developmental Disabilities and Department of Aging for the services. So as you see, for the people who are on DODD waivers, the services are in phase 5 for the DODD waiver programs. So as of October 1st, all of the services that are delivered that are subject to EVV will have their claims validated to make sure that there's a electronic visit verification data that matches the claim that came in order for that service to be paid. Now, take that in for a second. What that then means is if there is no EVV, if somebody's not been logging their visits into our system, then as of October 1st, those services will be denied. That's a big deal. That's a really big deal. So we want to do our best to prepare. So that's why we're here. We want to make sure, first of all, everybody knows we are telling as many people that will listen to us that this is coming because we don't want people to be caught off guard. We want to make sure that people are doing their due diligence now to make sure that they're connected to the electronic visit verification system, that they know how to log their visits, that they know how to fix a visit if something's gone wrong in their information, and they know that they're getting successful matches with their claims. They can see this now. They can actually see what's going to happen today if they go in and check in the systems. So they would know today how successful they're being, but they have to be in the systems to do that. And so we really need to figure out how we spread the word, first of all, and second of all, get the support to people who need it so that they're able to successfully do this matching now. So when we get to October 1, we have the very least effect on the services as we possibly can. So that's really one of the things we wanted to get feedback from you all who work in the field and you're out there implementing waiver services to know what are the best ways to reach providers, what are the best tools to give them to help support them, how do we help them know how to connect with the Sandata team to get the support that they need so that they get with the right technical teams to have success here. So that's really part of our goal for today is to make sure that people can give us feedback so we can tailor our messaging. Department of Medicaid's already been doing this. So we implemented our first round of claims validation for home health services specifically on March 1st. And we went into that knowing that we were still having some providers who were struggling. We've done a whole lot of work to try and provide hypercare, to provide the support necessary to do direct outreach to providers that we can clearly see struggling. We see that in the data. So we had done all of that work going into the March 1st implementation for us. And now we're working with DODD to try and do the same thing to make sure that we're doing as best we can to help and support people so that when we get further down the road towards 10-1, the providers are in good shape, that they're making the best matches that they possibly can, and that they know how to get the support that they need if they're struggling. So this is the timeline. I'm gonna just pause for 1 second. Does anybody have any questions about this? Yeah.
I want to be able to hear you.
Yeah.
All right.
Can I add one thing while we're waiting for that is providers, often provide services kind of across these service spans. So there are already DODD waiver providers who are using EVV and using it for their claims implementation because they're also home health providers, and the state plan home health services are already using EVV. So there are some of our providers who are doing that. It is a very small percentage, but it's started across the service system that way already.
Yeah. Great. Thanks, Allan. Good point.
I think I have two questions. So is EVV tracked in real time? So do they have to enter it the minute they start providing services, or can they go back and put the information in?
Yeah, that's a great question. Do you want to jump in or you want me to? Go for it. And then you fix me. Okay.
Brandi,
So,
can you just bring your mic up just a tad now that
Yeah.
I'm sitting here? I want to hear you.
Is that better?
Yeah.
Okay, good. So both can happen. So your question is, do they record their visit in real time, or can they go back and fix it or enter it later? So either one is possible. So people have the ability to use the app from Sandata, so they could record their visit in real time. They clock in when they get there, they clock out when they're done. So that's a real-time application. There's also a real-time application through the web. So they could go to, if they didn't have their phone or their phone wasn't charged, they could go on their computer, log into the Sandata app the same way, clock their time real time. If somebody missed that time frame for some reason, they were at a site that didn't have any power at that moment, or something happens, yeah, no service, that happens too, right? Then they absolutely can enter the visit manually. So that can be entered later and include the start and end times in the same data elements. Yeah, so all options are available. They also can call in. So there's kind of another method. So if somebody doesn't have access to a computer and they just have a phone, they can actually call in and record their start and end times through a telephony solution.
You answered my other question, which was, is there a GPS component to this? So no, because they can log in afterwards. So they're not being recorded where they're going. But if services are provided in multiple locations, how is that documented?
Yeah, great question. So in our rule revision in July, we actually removed the requirement for GPS location as a part of our EVV solution. We had a lot of stakeholder feedback about that. And so we said GPS is no longer a required element. It is optional. So if somebody wants their staff to have to record where they are when they clock in and they clock out, then the individual receiving services can consent to having GPS being used to record location. So it's an option, again, to use the GPS, but it's not required at this point. Because location is one of the required elements from CMS, we still have to know some information. But the only requirement is that we record is the service at home or in the community. And so it only records one of those two choices. And it's recorded at the beginning of the visit and at the end of the visit. So if you happen to start at home, drove somebody to work, and then ended the visit at the work location and clock out at the community, you would clock out at a different location than where you began. Good?
We'll keep going.
All right. Somebody had a question
Was
over
there
here.
another
Is there
one
still a question?
about this? Oh, my bad. I just am too comfortable.
Okay.
Hand up. Sorry, just want to make sure.
And then why don't you, do you mind going ahead and skip ahead to, let's go to
A
slides
couple
here.
of slides back, you
Oh, you wanna go
mentioned the warm handoff to Sandata. If not, would the providers be provided with a phone number directly to Sandata so they don't have to go through you to get there? Or do they have to go through you in order to contact Sandata?
You want to do that? All right.
Yeah, I can hopefully help answer this one. There will be a phone number that is provided to our direct support line. So we don't have to dial DODD to then become over to Sandata. There is a direct support line that's available, and our staff is ready there to handle any of those questions that come up.
Thanks, Lisa. We do have those hotline numbers, at least the Department of Medicaid's hotline number and the Sandata hotline number on the handy dandy business card over here. Feel free to take a bunch. And then we also have a contact sheet that has the contact information for how to reach the Department of Medicaid's Integrated Help Desk, and then the various resources that are available from the Sandata EVV team. So feel free to grab whatever will be helpful to you. And all of those same resources are on our website as well. Yes. All right. There's another question in the.
Oh, it's up to you. Do you want to keep taking them? I'm just giving up on it. You're good, sorry. Okay.
Sorry, Lisa. So just for clarification, the one that is not in real time, is that put in place for our rural areas where they do not have access to internet and cell phone service?
Yeah, absolutely. We know that there's circumstances where there are communities who don't use electronic solutions of any type. So we do have the manual option for people who don't have access to internet, for our Amish communities who might not be willing to use a solution that we're offering. So yes, absolutely, manual entry is possible. It certainly is, we prefer it to be by exception, right? We don't want that to be the norm, but there's circumstances where one of the electronic solutions we're offering or asking people to use might not be an option for various reasons. Yeah, absolutely. All right, I know you all can't see this, so let me just give you that as a disclaimer. This is our technical roadmap for what happens when claims come in and they are subject to EVV. What are we testing? We do have copies of this if anybody really wants a little bit of light reading. But this is the technical roadmap for how we test the visits to make sure that when the claim comes in, the visit has a record that shows us that the visit occurred. So these elements are what the Department of Medicaid is testing, and we test at 4 different intervals. These first 2 are really just, do we have the right data on the right people? On test 3 is where we start to really get into, did we see the visit that we expected to see? And when we look for the visit, we're looking to see, is there a service on that date that matches the service that they're submitting the claim on? So in your circumstance, is there an HPC visit on this date? And does that specific service match the units that are in the Sandata system? So that's test 4, is the units. The Sandata system records time, right? So it records when somebody clocks in and then when they clock out. The Sandata system actually then converts that into quarter-hour units. So the Sandata system already knows the answer to what was provided. They know how much time was spent at the site. The claims validation process tests service, date, and how many units were billed, and does it match, or is it the billing less than what was recorded in the Sandata system? So those are kind of the technical pieces of what the testing of the claims validation process is going to do. So I don't understand either. I'm trying really hard. So can we go to the next slide then? Because this is a little bit more probably familiar. Well, it might not be helpful though. Oh, let's see if it works. There we go. So it is another eye test. You do have a copy of this. So this is the flow for DODD waiver claims, because we know that your flow is different. You're not billing the Department of Medicaid directly for most services and not for your waiver services, except waiver nursing. So the DODD system's flow is a little bit different. So because there are other safeguards in the DODD system, like they already know who the provider is, they already know that the recipient information is going to match, their matching process is going to then really just tailor to the visit itself. So then they're going to look for the visit and check to see, is there a visit on that day for that service, and how long was that service rendered? And that units calculation, again, is happening already in the Sandata system. So then the DODD system is going to check to see how many units did you bill, and are those number of units the same or less than the units that were on the claim or on the visit. And that's it. So it's really not, it looks very technical, looks very complicated, but from an elements perspective, there's not that much to it. The good part about that is, if there's anything wrong, if anything is being denied, or today they're getting a warning that says this claim wouldn't pay because we don't see the right information in the electronic visit verification system, the method to correct those things in the EVV system isn't that complicated. There's one place that they need to go. There's a system that gives them red dots to tell them where the problem was, and then it will guide them through the solution on how to fix that if they're using the Sandata solution. If they're using an alternate vendor, it's a little bit different because they'll have to go to their alternate vendor to figure out what happened with that EVV data, because they're the ones who supplied it to Sandata. Sandata can tell them what was wrong, but Sandata can't fix it for them because they're using a different solution, and that solution is feeding data in. So the providers have to be very aware where they're getting their data collected, but they can use the Sandata system regardless to tell them what happened. Why am I not getting the matching that I thought I should? So those are the benefits of people really getting familiar with the Sandata system, because no matter what happens, no matter what solution they're using, the Sandata system is the one that's going to tell them where they had a problem in their visit, and then they know how to go to Foote to fix it. So,
Can I ask there's a question in the chat from online that says, when working to authorize a recipient, does it matter if you choose the option units or hours? Our providers bill in units, but some are choosing hours when adding in their clients in EVV. You just brought up the hours. That's what I was just thinking. I thought I would ask it.
yeah, no, I think that's really good. I don't know about the entry for the recipient, so I'm looking
All right,
around.
we'll keep that question.
Question about authorizing services like on the PAWS and the DODD system?
It
doesn't say it.
Yeah, it just says, I mean, you're right, it says when working to authorize a recipient, does it matter if you choose the option units or hours? That would, I mean, the county board should authorize the way we've always authorized, which is units.
I would think that either of those options. We'll confirm this, but I would think that either of those options would be appropriate, because when we are, matching, is the amount being billed the amount
It's switching,
that is
yeah.
authorized, as long as it's units or hours and the amounts match or less than, there should not, I wouldn't expect there to be a problem, but we can confirm that. I do see the other question there about shared living providers required to use EVV, and the answer is no. Any of our providers who either are paid a daily rate for a personal care or home health service or are a live-in caregiver are not required to use EVV. The shared living portion is automatic. No shared living claims are going to be tested for EVV. Providers do have to get a live-in caregiver exemption if they are providing services to someone and they live with them, and it's not shared living. So if you're providing HPC to someone that you live with, you would have to get a live-in caregiver exemption from ODM to not have to use EVV for that.
I think they did try to clarify that they thought, they think they are talking about when you set up something in the online Sandata app.
All right.
Hours versus units. So it sounds like maybe a provider.
Yeah. Yeah, I think so too. So the answer we think is that it will convert regardless of how you set up the units in there, but we'll double check that and give some feedback. So thank you. Those are really great questions.
All right, these are all answered live. I don't know why it's still, done. Let me say done and we'll keep moving for a minute.
All right, awesome. So let's go ahead and bounce ahead a little bit on the slides if we can.
Oh, I told you I was going to mess with you. Sorry.
Yeah, that's fine. All right, I'm going to go ahead and turn it over to Lisa.
Perfect. So like Brandi was mentioning, what we've done so far is based on learnings that we've had from our previous phases. With that said, we're going to share some resources on exactly what we've done before, but we do welcome feedback. If you have ideas that are not seen here, please bring them to us, because ultimately, again, like Brandi was saying, this is to make sure that all providers are equipped the best way possible, and whatever that looks like may be different from what we've been doing in the past. But what we have been doing is we set up multiple times a month different training sessions. So we had one this past week that was on how to master data entry. And what that really includes is a step-by-step guide on setting up essential information in the EVV system, including how to set up the recipient information, managing some of those authorizations, creating employee profiles, exporting data, and more. So what our setup is for this is we have the hour webinar that's hosted with a live person to go through the webinar materials itself. And then 2 days later, we have a specific Q&A session where people can come back and ask questions based on what they've learned after they go and play with the system, or they just have general questions anyway. They can bring it directly to that Q&A session, and we'll have our team answer those questions live. That same setup is happening on the 20th for visit maintenance, where this is all about how to resolve those exceptions that we're seeing. So those red dots that Brandi mentioned, this session is specifically on how to resolve some of those exceptions to avoid the claims denials. It's how to locate shares how to locate the information, again, how to resolve that, and has that same setup. So while I do want to mention, while at the end of the webinar, there is time for Q&A. We obviously can't get through everything that's specific that people have, so that's where that second session does come into play. You can register for one, you can register for just the Q&A if you don't have time to sit on the webinar, or you can register for both. That is all available. And on the end of the month, on May 29th and June 17th, we have a claims matching session. And this is really just how to fix the top 4 claim errors that we've seen. So we talked a little bit about the unmatched units. So if we're seeing a mismatch in the system, that error will pop up. We'll walk you through how to fix that. Same thing as if the provider ID does not match, the recipient ID does not match, or the procedure code does not match. Those are our top 4 errors that we typically see within the EVV system. And so we'll walk you step by step on how to resolve those. And again, those are scheduled for May 29th and June 17th. Anyone can join these sessions whenever we offer them. The links to register are on the ODM EVV website, so you can get those there. And with that, next slide, please. Maybe. I don't think it moved, did it? Yeah, okay, here we go. So also on the ODM EVV website is a link to sign up for daily office hours. So this is another mechanism if people can't make our webinar sessions, there's another opportunity to get that one-on-one support by joining these office hours. They're hosted every day. On Mondays, they're in the morning, and Tuesday to Friday, they are in the afternoon. Like I mentioned, the link to join and to register is on the ODM EVV website. And really, this is just another opportunity to ask those specific questions, whether it's general about EVV, the team is equipped to answer those, or if it's more technical with a specific incident that the provider is trying to work through, we have the team equipped for that. I'll also point out that these office hours, we have the resources and staff available to help whether the providers are using the Sandata EVV system or an alt vendor. We are able to help, like Brandi mentioned, there's some limitations with the alt, but we can still try and troubleshoot as best as we can during those sessions. In addition, we had the question earlier about our support hotline and how we can get directly connected to the Sandata system and our support team if needed. The phone number is here. Like Brandi mentioned, we have some handouts if you're really that interested in grabbing one of those to see the phone numbers. It's also on the ODM website as well. And if you can't call because you're, for some reason you don't want to or you don't have access to place a call, we also have an online submission form where you can submit an email and then our team will get back to you that way as well. I mentioned the alt users, alt EVV users. We don't, because they are a little bit different in that nature, like we've been talking about, we have specific training sessions that are set up for those users. So like the ones that I mentioned earlier are really for our Sandata EVV users. But because we don't want to forget about anyone, we have these monthly training sessions that will take place for alt EVV. The first one is starting next week on May 14th, and the next one scheduled after that is for June 11th. The topics will vary, again, based on needs that we're seeing and that are coming into those sessions. And like I mentioned, also office hours is there. We have a specific technical support number to our support team for alt users. We have a slightly different team that helps manage those. So we do have that direct contact information here, along with a different email address that can be used to get that direct support as best as we can offer. And you'll get this, they're getting these slides? Perfect, so you'll have all of this contact info at your fingertips as needed. Oh, I'm gonna pass it back to Brandi. Oh, yeah, we can do that.
Sorry, that's a scary mic. Okay, it's fine. Okay, thank you. So I just want to understand, because like you said, EVV has been around for a while now, and providers that we work with have been using EVV since its inception, I think. But the difference is 10-1 claims will be denied, and right now claims have been adjusted, and there's been some adjustment that's been happening, right?
They get a warning.
They get a warning.
They get a
Okay.
warning that says, you don't have a visit that matches this claim, something in your EVV data isn't working.
Okay, and so then there's an ability to kind of figure out what that was. But at this point, as of 10/1, that warning's not happening. They will be denied. And those are the questions that you are foreseeing coming to county boards, SSAs, saying, why haven't I gotten paid for this? So this is the information that we need to know. It's not that this is new for anybody, that they've been doing this, but they have to know now that they will be denied claims if they're not doing this correctly.
Yes, yep, that's entirely it. So, right now, providers have to use EVV, but there is no any claim impact if they are not. So there are providers we have who have never used EVV yet, despite it being a requirement for the last 7 years. And they get the warnings on their claims, but all they receive are those warnings. Starting on 10/1, those claims will be denied if they have not properly used EVV to have the visit.
Just to add one more thing to that, that's why we have some of our sessions set up right now. If people are seeing those warn edits or those warn warnings, that sounds funny, but have them come to Sandata to help now before we get ahead, so we can get ahead of things and they don't get in a panic later on.
All right, another question?
Is there, or what is the time frame to enter a manual claim or to go back and correct? Can you go back the full 350 to match when providers can bill?
I don't think there's anything that would restrict them in EVV, right? So they could make a correction if they needed to. Yep, sorry. So yes, absolutely, somebody could make a correction in either the Sandata system or their alt EVV for the visit. Or if they find that their visit information was wrong and they just billed and they thought that the visit happened as planned, then they can actually go back and resubmit their claim and have their claim readjudicated as well. So they can correct it on either side depending on what the issue was. So we know that some providers have their billing system set up to bill based on schedules, right? And so if that's what happens and their visit didn't actually occur the way it was planned, then they can correct their claim and resubmit that as well. So there's lots of ways that people can get themselves to the end goal of getting paid with those corrections that need to be made.
Follow up?
Actually, not related, but is there an easy way for county boards to get access to, I think you had said that providers that aren't using it or, and the claim data, so we could, when we're looking at fraud and things like that, so we could have the data for people providing services in our county?
I think so. So I'm going to answer for the dashboards because we're supplying the dashboards. So the dashboards that we have access, that we provide access to DODD to use, provide that information, that level of information. Providers actually can go out. So as we're moving into these other phases, we're providing dashboards for providers to check themselves, and they can use the reports that are available from the DODD website. So there's lots of resources that are currently out there and available to them. We can't give county boards access to the same dashboards that we are providing with DODD for privacy reasons, but they do have access to the information that's coming in from the Department of Medicaid, so they can have that access to that information.
I think, right now we're using that information and planning to use that information for the next 6 months really to identify training and outreach opportunities. And Weisson's provider support team is using that information, those data, to work with both providers and with boards. They're working with boards as well to reach out to those providers. And so I do think there's opportunities for us to share that information, those lists with county boards and their provider liaisons as well to help with that outreach.
We're going to grab one more.
A few slides back, you had some training sessions that people could attend. If they weren't available at that time, is there going to be links where they would be able to go back out and see that? And could you send those links to us when you send out the slideshow?
Yes, so if the webinars dates don't align with schedules, they're absolutely are posted on our, what we call our Sandata On Demand resource site. So we can make sure that we share that link as well. And there's also, this is not just one and done. We'll be continuing these through June, July, August, September, and future sessions. So if they can't join one and their calendar aligns for another one, they can more than happily join one of those. But we'll make sure we get the link to you where the recordings are posted.
think one of the things that's really important, and hopefully as county boards, as you're working with your providers, you're hearing from us how important it is that providers are connected to Sandata. So no matter how they're collecting their electronic visits, and we know they all have different solutions that they might be using, and maybe they aren't really even using the Sandata solution, they need access to Sandata to see what's going wrong and where they're having trouble. And that will give them the cues about what they need to correct. So I feel like if county boards can help to spread the word about that, because some providers might not think they need to be connected to Sandata because they're using an alt vendor or they're doing some other solution that they maybe don't see themselves connected to Sandata, but that really is the key to helping them with their success in this particular space. If there's ways that we can help with that we can help spread the word, happy to do that. Would love your suggestions on that. We've been reaching out to the providers who aren't currently connected to the Sandata solution. So we've been sending them notes and emails and robocalls and everything we can think of from the Medicaid perspective to say, we see you're not connected. We see you're not using Sandata. We see you don't have a Sandata account. And it's going to matter to you very soon. Please get a Sandata account. So we've been trying to do that through our mechanisms. But if there's other ways that we can do that to help them get connected and start to view their data and see where they're having trouble, please let us know what that would be so we can make sure we use that avenue as well. All right. I only have, so this one and then lots of question time. Okay, awesome. So we re-implemented a stakeholder group because we, again, are just trying to get connected and understand what people need to make sure that they have the support going into these different phases. So the Department of Medicaid just re-implemented our electronic visit verification stakeholder group. We're meeting every single month to talk about different topics to make sure we understand what people need. We want to make sure we understand where people are struggling and where they're having trouble. Any concerns or complaints that they might have, we want to hear those so we can make sure that people get the best customer experience possible. So if you're interested at all in stakeholder engagement and you want to participate in those calls, by all means, go out to our website and you can register for our upcoming EVV stakeholder meetings. We've had good attendance. We've gotten amazing feedback so far. Lots of things that we're working on already to try and create better solutions or more viable solutions for people based on the feedback we've received to date. So certainly would encourage your participation. I know several people from the County Board Association and several county boards have already started to join us, so thank you for that. And again, it's just another way for you to connect directly to us at the Department of Medicaid to be able to make sure that we're providing the best support possible as we move into these phases. Can we go to the next slide? There you go. There's the schedule for what's coming up. If you happen to be someone who sat in and listened to our last meeting that happened at the end of April, you would have heard our conversation about pending rule updates. So we've talked a lot about alternate EVVs today. In our rules as it exists today, the alternate EVV solution is only available to agency providers. So right now, if you're an agency, you can choose an alternate system who then sends your data over to Sandata. In our proposal for our rules, we are looking to change that to allow independent providers to choose an alternate solution as well. So this is a new change. We took it to the stakeholder group to see if they had any feedback for us. They certainly did. So we are proceeding with that rule change and making that proposal soon. So more opportunities for people to give us feedback through the public comment period. But we are looking to change our EVV rules so that the independent providers are able to choose an alternate system as well. If they choose an alternate system, that would not be free of cost necessarily. The solutions that we offer through Sandata are free of cost. But it would be an opportunity for an independent provider that they have not had in the past with our EVV solutions. So that change is coming as well. All right. You want to ask some questions? Okay.
All right, I'm here. Okay, so somebody asked, will trainings that are scheduled closer to October be more focused on DODD providers using EVV?
So yes, we can absolutely make it more tailored, and this is exactly why we want this type of feedback, so that we know exactly what type of information would help tailor and go that way. We'll probably still see some of our common themes, like we talked about with the existing webinars, of how to resolve some common errors, things like that. But if there is anything specific to DODD, please let us know, because now is the chance to work with our training team to get those tailored and get them ready to go. So great question, and please send any additional thoughts that you have to Brandi and myself, or to this inbox, actually.
Awesome. All right, I think we answered Marcy's that the trainings, some of the trainings are recorded and on the Sandata website, so we'll make sure that that
Yes,
gets.
and actually, right after this slide, there is one more slide that
Oh.
will cover some additional resources, and the link on that final slide is to all of our Sandata on-demand resources, including those recordings and some other helpful information. I'll talk a little bit more about that in a minute, but. Okay.
Because I'm in the chat box. All right, if they get denied claims after 10-1, will they be able to go back in and fix the issue in the EVV system?
Yes.
Okay, I like that answer, quick and easy. All right. If someone does not have supporting EVV after 10-1, do they have the ability to manually enter info and then rebill? Will that be permissible? I think that was kind of like the other one. Yes is the answer. Yes is the
Manual-
answer.
yeah,
All
Manual
right.
entry is possible, but that's part of why we're doing this now.
Yeah, we want to
because-
do it so you don't have to do that, right?
Right, exactly. It's better to get ahead of it.
Somebody did think that county boards can pull reports from EMBS, Allan, so possibly by county. That one's done. Okay. Some jobs have a grace period when clocking in and clocking out. Will there be a grace period for providers? Say they bill for 20 units, but they clock in at 12:04 and round to 12 o'clock and clock out at 5:02 and round up to 5, if that makes sense. Like, is it exactly whatever they clocked in and clocked out, I think is the question, or is there a?
So it's based on units, right? So units have a little bit of, it doesn't have quite as stringent of a standard as a time, exact time match. So all claims are billed on units, and the EVV claims validation testing that's done is on units.
Okay. And then there was one question about, just again, from the SSA's requirements regarding EVV, and kind of just saying, what do we have to do, which I know we've talked about, but also then, does this have to be in the plan?
It does. So I think, the SSA requirements are that the SSAs help people understand their Medicaid services and the requirements for those. EVV is one of those. I think there are some choices that come with EVV, like would you want GPS to be utilized or not, that the SSA can help the individual served think through and talk through, but I think the expectation is that yes, it would be included in the plan, and the SSA helps educate the individual on the fact that EVV will be used for certain services.
There has been quite a bit of talk about that and having it in the plan, so that hopefully there'll be more information. I believe that the compliance department and the Ohio ISP folks are going to be giving out some potential job aids, right? And we are looking, there's also been a lot of the stakeholders did request that possibly that be part of any kind of enhancement to the Ohio ISP, but we don't know that, and we won't for a while. So in the meantime, we need to look at, that's on the compliance tool right now for TA, right? That's right. Okay, it's TA in the compliance tool right now, so you should be having those conversations about what makes sense at your county to document that.
Not about that, actually. I'll let that go for now. So you've done this with other systems, you showed the rollout plan. I'm curious about impact to people served, and when this happens with providers that serve people that are eligible for our services, and the potential, fallout, frustration. Do we have any guidance, talking points on how to talk through that? We certainly don't want providers to up and be like, I'm done, I'm not doing this, too difficult. We need to make sure that people continue to get the services they need. I don't know if you've seen that in the past with other groups that you've done this with. What kind of guidance, support have you offered to those people who help individuals get the services they need, so we don't see people not getting what they need?
That's a great question, and that is our concern, absolutely. So thank you for bringing it up. We want to make sure that people can continue to get the care that they need in their homes, and so we need to figure out how to help support that. So a couple things that we know. We know that your call centers and your local county boards are going to get phone calls. Absolutely, 100% you're going to get calls. We have some already existing call center kinds of tools and tips to help you. It's out on the Medicaid website now, so that your county board staff and your SSAs have access to information about how to have that conversation with people and how to get them connected with Sandata to get the solutions that they need. So those are already out on the Department of Medicaid's webpage, and we can certainly distribute those around again, not a problem at all. We have developed a number of job tools to help our local agencies with those conversations, and we're happy to do that here as well. We know that sometimes it helps us if we give you back information that is about your services and how you do services. So that's some of the work that we're doing currently to make sure that we modify our outreach efforts so that it speaks to people and they understand it in a way that you all speak to them about their services, because it's different than how I might talk to my home health agencies. So we'll make sure that we're continuing to refine our tools to be able to provide that level of support. We're working with DODD on strategies for what do we do when we start to get towards implementation. So right now we're doing our outreach strategies, and then we'll be doing some hypercare and some extended services to make sure that we give people the support that they need as we get to 10-1. So for example, from the Department of Medicaid, what we did when we took our services live on March 1, we did what we called hypercare. And what that meant was we always have 24/7 support from Sandata. Sandata has the 24/7 hotline. We provided extended services on our integrated help desk. So we ran weekend hours and extended hours to make sure we had support there for the claim side. We also did the warm transfers, and that was incredibly successful so that people didn't get frustrated going from one line to another. We really want to try and mitigate against any abrasion if we can. And then we actually did direct outreach to the providers that we saw their claims getting denied. So we started an effort right away from the very beginning that said, oh, we see that this is happening, let us help you. So that we were the ones making the outreach to them to say, we see you're struggling, let us help you get where you need to be. And that was also incredibly successful. Can I do a plug about living caregivers? All right. I know you all have been asking. I know people have been requesting living caregivers. We know that that's been a source of frustration and challenge as we were working through that process. So living caregivers are now able to request exemption online. It's no longer a paper form. There is a paper form available if somebody doesn't have access to be able to do the online submission, but people can go straight to the Medicaid webpage and request a living caregiver exemption right on our website. So hopefully that helps to ease that process a little bit. As we refined that and went to the online process, our speed at processing those has gone up dramatically. So we are processing requests within 1 or 2 days of receipt. So that living caregiver response is going right back out to people. We know as we did the paper process, people struggled a little bit with that, with some of the content that they gave us, and they might have, missed a Medicaid ID digit or some of those things. So we're catching those now because our online system actually won't let them proceed unless they gave us 12 digits for a Medicaid number. So we tried to put some of those safeguards in, and we really are seeing that that's made a big difference in our ability to turn those requests around. So if you have folks that are waiting on a response from a living caregiver request that they've submitted to us, those answers have all been sent back out. We do know that we did have a high number that had to be returned, that we couldn't process them for various reasons, like the documentation wasn't supporting that there was a live-in. They asked for all of the services instead of the services that were being provided, those kinds of things that people might have put through at the beginning. But all those have been taken care of, and all the responses have gone out for everything that was received up until just a day or so ago. So hopefully that helps with your experiences, and if you still have people that need to request a live-in exemption, they can go online and submit that at any time.
I just had a comment on the previous question, which was, I'm grateful that we have time because we as county boards can be proactive and reach out to our providers and just be like, hey, are you doing this? Hey, if you're not, can you start doing it now? And I think that makes a huge difference, right? If we are being the voice, because maybe they're not reading the emails or they're not, you know what I mean? But we see them all the time. So it's like, I'm on the phone with you. Hey, by the way, do you know about this?
Yeah, we would very much appreciate you doing that.
Yes,
That would
that
be
is
incredibly
exactly
helpful.
right.
There was a question in the
Yeah,
back.
is there, okay, I was gonna say, I think there's one online too. All right, oh, you don't have a mic, Andy.
I just wanted a clarification. When you say live-in care worker, like direct care worker, like a parent of a minor, is different than shared living.
Correct.
This would be a person who's billing HPC, not shared living, correct?
That's
Okay,
correct.
thank you.
Yes. Yes. Shared living is not subject to EVV.
All right, I'm gonna check we're almost done, but let me just double check what's in the chat. Oh, of course, they started asking, okay. Somebody asked as an idea, well, they said, thank you, it's been very informative, so I'm not ignoring that, and it has been. Can we have a step-by-step guide for DODD providers setting up the system from the very beginning? Linking their Medicaid number to EVV, logging into the EVV portal, a lot of that stuff. And obviously we have some pretty intense provider support departments that are willing to help people walk through it.
Yes.
Yes.
I was going to say, on this Ohio User Guides website, there is a ton of information on exactly that, the beginning process of how to even get started to some of the more complex topics. So please use that user guide. And as we mentioned too, if that doesn't help or you want some one-on-one direct support, we have our office hours available. And the office hours are exactly meant to help answer some of those questions on how do I even get started? How can I help get into the system? What is the step-by-step piece there? And same with our support line. If you need that assistance, that's what they're there for as well, to walk through that with you and help you guide you through that.
Okay, we're gonna do a rapid fire. This is gonna be good. Some of these are easy. Does this apply to both agency and independent providers?
Yes.
Yes.
Yes, all right. A lot of questions around the exemption. Some people said what to do if they haven't received any notice back yet. If they're not hearing anything, should they call or just resubmit?
So the answer would have gone back to whoever submitted the request. So if it was a request that was submitted by an agency, the direct care worker wouldn't get the answer. It would go back to the agency. So I think that's really important to check with your agencies if it's an agency staff person waiting to get that response. If they don't have, it's not on that list. If they have not heard back from our department about a request that they submitted, they can email evv@ohio.medicaid.gov, and they can give you a direct answer about where that submission is.
Okay, and is there a link to the exemption form in here, or just, it's on the website, I'm
So
sure?
it's on the website, and then it's under resources for providers, and then there's a whole section for
I was
living
gonna say, it's pretty,
caregivers.
I found it the other day.
Yep.
Has GT for PDHPC provider through GT, has that been approved to use EVV yet or not?
So they are still in the process of getting their alternate EVV certification, but the data collection is no different than any other data collection they're doing. So it's a one step for somebody who is doing the the participant-directed HPC services. I have to get your acronyms in my head. So GT Independence is collecting visit information. They're just not sending it over right at this moment. Anybody who is a participant-directed provider who requested a live-in exemption, those are being processed because GT Independence has loaded all of the caregivers into the Sandata system. So those are being processed.
Okay. Does the exemption apply to, okay, I think you just answered this. Does the exemption apply to live-in caregivers of HPC who do it through an agency? Yes?
Yes.
Yes.
Yeah.
All right,
The
sorry.
best time to do it.
Do you know if third-party billing vendors that some providers use are verifying the correct EVV entries?
Oh, that's a good question. It would depend on the biller and their relationship and whether they're the EVV or not. So I would recommend that you contact your biller and the EVV if there's a separate one.
Okay, and I'm not going to get to all these because you just all keep adding them, and it's 4:46. But we've got a ton of resources to go through. The only one I was going to throw out was there was asked if there's any talk of changing the rule to eliminate the requirement for live-in caregivers, since you have the exception.
To eliminate the requirement.
Yeah, has that been talked about in any kind of official stakeholder?
It hasn't come, yeah.
I would say there's not a requirement. For living.
But you have to do the exception, the exemption.
Yes, and really, because it's the only way we would know. Like, if you are billing, there's nothing else when you're billing for us to know in an HPC claim if you are a
Yes,
live-in
'cause the
caregiver
code's
or
the
not.
same, yep.
Because the codes are the exact same. So we have to do the exemption form so that we're able to exempt you.
Perfect. Okay, I'm going to go ahead and shut it down. I don't know if you needed to point out. You guys are amazing. Lots of wonderful comments. Thank you so much, everybody. Have a great day and hope to see you at the hospitality event. You can come up. These guys will hang out for a little bit longer.